Approximately 3.4 billion people worldwide use smartphones and tablets. And according to mobile industry estimates, 50% of them have downloaded a health app. Dr. Freda Lewis Hall, the Chief Patient Officer of Pfizer, is back to talk about how using these apps could be beneficial to your health. Welcome back, Doc.
Thank you. So great to be here. You know, there are over 300,000 health apps that are available.
That's a lot of apps.
That's a lot of apps going on. So by applause, how many of you have used a health app? Oh, okay. There's one thing that people may not know, though, or may not realize, and that is the FDA does not review, regulate, or monitor health apps unless they are either connected to or intended to be used as a medical device. Now, what that means is the vast majority of health apps have not been reviewed by the FDA, so they should not be used to diagnose or to treat an illness. But they can provide important health information to people when and where they need it, can help support following a medical health plan that's been developed, and can help motivate people for healthier lifestyles and behaviors.
And if used appropriately, some apps might even be life-saving. If you think about it, as an emergency room physician, I'm a big fan of an app that would allow you to create a medical ID with information like your blood type, allergies, or the medications you're taking. They can be accessed by first responders or emergency room staff without having to unlock your phone. So we can check for critical health information and emergency contacts, even if you're unconscious or, in certain cases, unable to communicate.
And some apps provide an estimated count of calories so that you can keep track of what you eat. Or they help you track your activity so you can stay on the move. Now, I use a health app to track my blood pressure, my sleep patterns, my weight, and help me keep track of my activity by counting my steps. So, for instance, I happen to know it's 145 steps from the dressing room down to the stage.
Really?
Oh, yeah. So I got a lot more steps to do today, but at least I know I got those 145 in. So it really does help drive healthier behavior, and I'm excited for that. Now, do you use a health app?
I actually use a fitness app because I'm a big biker, and what I can do is I can track how fast I'm going, elevations, profiles, and then you can do the same ride twice, and you're really competing against yourself trying to beat your last time. So it's a little personal battle. You can do this, Travis. Beat yourself. Be better than the version of yourself yesterday. But remember, there are also health apps to remind you when to take your medicines, and some provide information on possible drug interactions. And Dr. Freda, this type of app can also benefit your health management. Approximately half of the 3.2 billion prescriptions annually dispensed in the U.S., they're not taken as prescribed. Think about that. That's a huge number. Of course, this can increase the risk of serious health consequences.
And the great news about apps like this, the ones that help remind you about how to take your medications, is that if you want to, you can also invite a family member or a caregiver to help remind you and monitor with you. So this could be especially important in someone who has memory loss, for example. So if you don't swipe that you've taken your medication, whomever you've designated to get the information will get an alert, and they can not only monitor you, but help remind you. And then likewise, you can remotely monitor someone that's away from you, a loved one that's away, to make sure that he or she is taking their medication as prescribed.
Such a great tool. And I'm also a fan of community-driven apps. And what they do is they'll offer support networks to patients as well as caregivers. They can provide tips, emotional support to people living with illnesses like cancer, diabetes, or even hemophilia. There are also apps to help quit smoking, and some newer ones that help you track your mood, pain, sleep patterns, helping you create a personalized graph or report that you can share with your doctor and your other healthcare providers to make those visits more productive. Because with less and less time with your doctor, if you have better information to provide, that can help the doc.
And one of the other ways that health apps can help is to provide information when and where you need it. An example of that would be, how can I reduce the risk of foodborne illnesses? And an app that helps with that might answer questions like, how long do I cook this meat? Or when is it time to throw these leftovers out? Or how long should I wash my hands after handling raw meat? And actually, you're not going to need an app for that, because I'm going to answer that question right now. because it's important, and it's 20 seconds. So after you've handled raw meat, you should wash your hands with soap and running water for 20 seconds. This may help reduce the spread of disease-causing bacteria. So that was kind of fun. I was the app for that.
I love it. We've been talking about the advantages of health apps, but if your problem is a phone addiction, ironically, there are also apps for that. They can track your phone usage and provide daily exercises to help you utilize your phone in a healthy way so that you can be present for the parts of your life that matter most. But remember, since all health apps are not created equal and some health apps can even do more harm than good, always do your research first.
That is so very important. So what we know is that technology can help manage your health if used appropriately. So if you're thinking about using a health app, talk to your professional healthcare team. Help them help you find an app that will work best for your needs and to help you manage the medical treatment plan that's been put together for you. Of course, there's lots of information to know about mobile health apps, and there's more available on gethealthystayhealthy.com. And as always, while you're there, you can sign up for our monthly newsletter.
And I absolutely enjoyed having you here today. Thanks, Dr. Freda. Stay tuned.